we will issue a mandatory shelter-at-home order effective 5 p.m. tomorrow, March 19th. The intent of this order is to ensure that the maximum number of people self-isolate at home to the maximum extent feasible, while enabling essential services to continue to slow the spread of COVID-19 to the greatest extent possible. We are still refining the details of the order, but we wanted the public to have advance notification prior to the order going into effect. The actions we are taking will allow us to get back to normal as soon as possible. COVID-19 is spreading in our county. Individuals who contract the disease could have little or no symptoms, which means they may not be aware that they are carrying the virus. We need to limit gatherings to prevent virus transmission and protect the most vulnerable and to prevent our healthcare system from being overwhelmed. We are working closely with our primary healthcare providers, Tenet and Dignity Health, to increase healthcare capacity if needed. Today, I authorized the emergency purchase of 100 additional ventilators for $500,000. We are also in the process of identifying supplemental care sites if needed. In regards to the shelter-at-home order that will go into effect tomorrow, essential services, businesses, and functions will be exempt. I'll now turn it over to our County Counsel, Rita Neal, to articulate these specifics.
Good afternoon, and I am Rita Neal, the County Counsel for the County of San Luis Obispo. I want to make clear that the order at this point in time is still in draft form. We are trying to be very careful and moderated in what is included in that order. So I'm going to go over a list generally of what the order is going to include and what things and activities that people will be able to engage in. And again, I caution you that this is a work in progress. If you'll bear with me, it's a rather long list, and I'll try and get through it as quickly as possible. The order is going to allow people to engage in essential travel, essential activities, essential government activities, and essential business. So let me first discuss what essential activities are that people may leave their homes to engage in. You may leave your homes for essential activity of taking care of your health and safety and that of your household members, your family members, and your pets. You may leave your home to obtain necessary goods and supplies, such as pharmacy items, grocery items, sanitary items. It also will include, you may leave your home for outdoor activity, including walking, hiking, and running. You may leave your home to perform work to provide for yourself for essential products or items that you will need to continue your businesses. And you will also be able to leave to care for pets or family members in other households. The order will also identify that you may leave your home to engage in healthcare operations. So you may leave to attend to doctor's appointments, dentist appointments, veterinary appointments, hospital appointments. Also allowed under the order will be the ability to engage in essential infrastructure activities. This will include public works projects. If there's roads or sewers or water that needs to be repaired, those activities will and can continue. Airport operations can continue. All operations as they go to water, sewer, gas, electrical, public transportation, solid waste, and also telecommunications. First responders will all be able to leave their homes. That includes law enforcement, dispatchers, anybody included in emergency management, and court personnel to the extent that the courts remain open. Essential government functions will remain open, and it's important to under this category to understand that each local jurisdiction will be identifying and defining what their essential government functions are, and we will leave it to each jurisdiction to identify those functions. Essential functions will also include nonprofit organizations and educational entities to the extent that they provide essential services to the public. The list of essential businesses that will be allowed to continue is also rather lengthy, and that will again include healthcare operations and essential infrastructure, grocery stores, certified farmers markets, food banks, and stores that provide household items such as cleaning items, sanitary items, personal care products. Food cultivation, including farming, livestock, fishing, and other ag operations will be allowed to continue. Businesses that provide food, shelter, social services, and other necessities will be allowed to continue operating. Newspapers, television, radio, and other media services will also be continuing their operations. Gas stations, auto supply, auto repair, and related facilities will operate. Banks and related financial institutions, hardware stores will be allowed to remain open. Plumbers, electricians, exterminators, and any other services that are necessary to maintain safety, sanitation, and essential operation of your residences will be allowed to operate. Businesses providing mailing and shipping services, such as post offices and post office boxes, will be able to remain open, as will educational institutions. And again, that also depends on what orders the schools have put in place themselves. Laundromats, dry cleaners, and laundry services. Restaurants and other facilities will be allowed to remain open, but only for delivery and carryout. Businesses that supply products needed for people to work from home will be allowed to continue to operate. Businesses that supply other essential businesses will also be allowed to continue operating. Businesses that ship and deliver groceries or other goods and services to residences will continue to operate. Airlines, taxis, and private transportation, providing those services for the necessity of what you will need for your essential activities will continue. Home-based care for seniors, adults, or children will continue. Residential facilities, shelters for seniors, adults, and children will also continue. Professional services such as legal and accounting services will be allowed to continue to operate when they are necessary to comply with the mandated services within the order. Child care facilities that are providing services that enable employees to work under this order will also be allowed. At this point in time, that's the list we have. Again, as I said, it will continue to be changed and amended, and we should be ready to issue the order sometime later this afternoon. Thank you. We need to introduce Dr. Penny Bornstein, who will give you the health update.
Good afternoon, Dr. Penny Bornstein, the County Health Officer in the County of San Luis Obispo. So an update on the number of cases I can provide to you. You heard the number is at 7. That's one more than we had yesterday. People seem to want to know the geography, so that additional one is in South County. So we now have 3 in North County, 3 in South County, and 1 on the coast. All are home under isolation orders from us, and they are all doing well and recovering. Our laboratory capacity continues. I think yesterday we said that there was a hitch in our being able to meet our full capacity, and we have resolved that for the time being. We now have additional supply that will carry us through the next few days, and within that few days we expect to get additional material to continue to operate at the pace of 50 specimens per day. We believe from both the fact of getting some of the positive results from private laboratories, as well as what we're hearing from our healthcare partners, that many providers now are using the private sector for purposes of doing testing, and that's a good thing because their capacity far outstrips ours at the local public health laboratory. As you heard Mr. Horton speak about, we are very much engaged in looking at our healthcare system surge capacity, particularly the hospitals. We had that important meeting yesterday, and now we have set aside a small work group to continue to evaluate the needs and the response systems that will need to be put in place if we come to that. And I guess with that, that is the basic, most important information, and we can turn it over for questions.
Question for Wade, the enforcement of the shelter home. Talk about that. I mean, this is voluntary. I mean, in terms of what you're asking, but I mean, how will it be enforced by the county?
So what we're trying to do is we're trying to encourage people to self-police themselves. We want them to comply with this order voluntarily. However, it will be a misdemeanor. Again, what's important right now is that you've heard about flattening that curve. That's what we're trying to do. We're trying to make sure that we don't spike the intensity of cases so we can accommodate the sickest of the sick in our hospitals. So by taking these measures, we're helping to prevent transmission of this disease, and allows our hospitals to treat the sickest of the sick without overwhelming their capabilities. If you'd like additional information as to the specifics of the enforcement, Rita can address those. But again, our intent is compliance, voluntary compliance. We're in this together as a community. We can get through this as a community, but we need to take these measures in order to protect particularly the most vulnerable among us.
So even if you're not, let's talk about activities like hiking or maybe surfing. A lot of people like to spend time outdoors. That isn't necessarily in large groups. What does this mean? I know the shelter in place, shelter in home, that's kind of the title of it, but are you able to do things like walking on the beach if you're by yourself or with your intimate partner? Or like, can you explain exactly how far this goes? Again,
the intent is to prevent the transmission of the disease. So if you're out walking your dog, if you're out surfing by yourself, or if you're with another person, maintaining that 6-foot distance, the goal is to limit transmission. So yes, you will be allowed to go out and surf. You can go out, go hiking, but what we don't want is large congregations of people that allow for disease transmission.
What about businesses that have production facilities like wineries? Are those not supposed to be operating?
So as Rita outlined a pretty specific list of activities that would be allowed, and those that we are requesting that folks stay at home. If a business is in the production of a critical component that is needed for an essential service, those businesses would continue. For instance, we were contacted by a company that helps produce the reagent that we talked about for the testing kits that Dr. Bornstein was referring to yesterday. Of course, we'd want those businesses to continue because they support a critical component of a key essential capability that is an essential service.
Any plan for homeless, trying to help them and come up with something?
Yes, so we're engaged with KOES, and we're also engaged with FEMA. We're trying to create capacity for our homeless to get those folks out from the creek beds. We want to limit transmission in the homeless population, and we do have requests for trailers through FEMA. We are tracking those requests, but to date we have not received those yet. I also want to indicate that one of the things I didn't indicate regarding this order that will be put in place, the order we anticipate for 30 days. However, we will reevaluate after a 2-week period. And if it's determined in consultation with the public health officer that we can lift that order, we certainly will do that.
Question for Wade or maybe Dr. Bornstein as well. We've heard reports, unfortunately, of people trying to profit off of this, people going door to door, claiming to be with some sort of health entity and wanting to ask people about providing tests. Have you heard about those reports? What can you say about people make sure that they're not falling prey to these people?
Well, I think that's pathetic. And if we have folks that are doing that and trying to profit off of this crisis that we're in, that's unfortunate. And I would encourage, if we do see price gouging, I encourage the public to contact our phone assistance center at 805-543-2444 and report that.
Which county offices will stay open?
So we're moving through that. We are currently working with our department head team to evaluate that. Again, the focus is maintaining social and health services, critical services. So, of course, the sheriff's office will remain open. CAL FIRE will remain open. Social services, public health. We will see service reductions in certain departments, such as our planning department. However, we are also implementing and working with our county team to implement telework policies so we can allow our employees to work from home.
So the planning and building department will stay open?
It depends. They'll certainly have reduced capacity. We will be allowing telework, but business as usual is going to change. We won't be able to process the amount of throughput that we are now. So will the Department of Planning and Building completely close? No. However, will the public counter be closed? Yes, it will. What we are adjusting our work process right now to try to maintain services to the public as much as we can, but it's going to look differently.
I have some questions for Dr. Bornstein.
Thanks.
You mentioned we have 50 capacity to test 50 people every day. Can you describe how we could possibly expand that? And what the capacity that you're receiving in the future, in the next few days?
We do not anticipate being able to go beyond that. It's difficult to describe, but in a public health laboratory where we are taking care of mostly hospital-based patients and using certain kinds of equipment, we don't have the same machinery, the same methodology, the same reagents that the commercial labs do, where they have throughput of up to 5,000 specimens a day. So we've got 2 machines. We added 1 more in the process of this. Our limitations are both the machinery as well as our staffing. We have added staff to our capacity. We've brought back retirees, but there just aren't a whole lot of public health microbiologists turnkey ready to join the staff, as well as we don't even have the physical capacity nor the machinery to expand beyond where we are today.
Are we not allowed to use those private facilities, those commercial facilities to actually?
Oh, yes, we absolutely are. We're encouraging the outpatient healthcare providers to use those labs and not ours. We want to preserve our limited capacity for those who need as quick a diagnosis as possible because they're in either a hospital bed and undergoing potentially critical care, or because we need to know as part of our contact investigation what the full circle of infected people are.
Do you know how many tests have been taken across the county, not just through your office, but through the commercial level?
We don't know that. We're trying to work with the state to try to help us get the full number of tests for our county that are being done in the private sector. At this point, we only know that which we've done in our lab, which now exceeds 200.
Do you know how many people have, at least through the commercial system, also been tested positive for this virus within our state? Can you report those?
Yes.
Mostly?
Yes. Out of the 7 positives we have, 2 of them have come from the private lab.
Okay, so they're reporting those numbers at least?
Yes. We're getting positives. Yep.
So with a finite number of tests available, what's the criteria for someone to have a test ordered for them?
So today we are allowing hospital-based physicians to make their own clinical judgment and send the specimens to us. They are actually doing the testing. They're collecting the specimens, they're putting it in viral transport media, they're sending it to us, and then we are running those tests. As far as contact investigations, if individuals either don't have a provider or a provider who is willing to collect the specimen, we are having them come to our facility, the public health department, and collect the specimen and then also hand it over to our lab.
So they'll need a doctor's referral to come in and have that?
Yes.
How much do you project the virus to grow within San Luis Obispo County? And can you say for sure, be confident in that? Because you don't actually know how many people test positive yet. You describe, the numbers. Can you have an idea about what it looks like?
Yeah, you're asking the $64 million question that has all number of different methodologies and models out there. We are looking at both best case scenario and worst case scenario. And the worst case scenario is what has led us to take this extra step of buying additional intensive care equipment in the form of ventilators and to be planning for worst case scenario in terms of hospital beds and intensive care. I am of the opinion that we won't reach the worst of what you may be hearing or seeing in some of these models that are out there. There is in a typical epidemic curve and one that comports with this kind of illness, we tend to see a doubling of cases week over week over the course of the epidemic. Part of the problem is we don't know how long the curve will last. But, so we've got 7 cases today, potentially 14 next week, or actually 3 to 5 days maybe we see a doubling rather than week over week. We've run all these different numbers, and it leaves us with a pretty wide range. And so we're preparing for the worst and hoping for the best.
You heard at the top Wade describe the respirators that were on order for $500,000. Talk about that time frame and when those might possibly arrive in the county.
Do you have it?
Sure. And also, do we have enough staff to be able to operate these things? I know it requires multiple.
So Penny can address that question, but as far as our ventilator orders, we literally placed that order 2 hours ago. So I know it's on order. I don't have the status of when they're going to arrive, but I do know that it's very difficult to find ventilators right now. There's a very significant demand for them, not only in this state, but throughout the country, and we were fortunate to find the ones that we did. I'll let Penny address the other question.
Can you talk about capacity for our system and what that looks like expanding it if there are, if you see that 60-bed ICU capacity that we have?
Right, so 60-bed ICU, roughly 450 what we call med-surg beds, so that's decreasing from the total labor and delivery beds, which will still need to be available. That is our existing capacity. Material is available to set up on-site mock probably isn't the best word, but alternative sites for hospital-based care. You're absolutely right in asking the question, but who's going to care for the people if we have expansion of our hospital-based services? We do have some surge capacity with respect to licensed personnel. We have a medical reserve corps where we've got a list of mostly retirees, and some are double dipping. They have day jobs but are also available to us for extended hours. And at some point, that if we do see the worst case scenario, there is the possibility that we will hit that point where either the staffing or the medical equipment might be our limiting factor, but we're doing everything within our power to maximize what is available to us.
Do you have numbers that you could cite for me, the surge capacity, how many you'd be able to expand, like beds-wise, and then maybe staffing, any kind of numbers that you can give us?
Yeah, I don't have that today on the top of my head.
What's the age or the age range of the latest case, younger or older?
The latest case is, I believe, an individual in their 40s, also with medical conditions, also like the others at home and doing well.
Do doctors have the necessary swabs and equipment to take the test? Is there an issue with that?
There is an evolving issue, but at present, we haven't hit the end of the road with that. So hopefully, as we're hearing out of the federal task force, that along with reagents, along with test kits, along with specimen, the swabs and the media, that all of that is hopefully going to keep up with the demand.
Earlier it was said that it's permitted for people to go to grocery stores. What if those stores become increasingly crowded, especially given this announcement? Is the recommendation just to stay 6 feet away from people, or is there anything else that people can do in that situation?
Yeah, and I may have Wade also answer this, but the recommendation in association with this order is in situations that involve essential services to continue that social distancing of 6 foot separation. I would add, I just want to get back to Ethan's question about what if you're with your intimate partner on the beach. So we consider social distancing to not include family units because they are already going to be living in circumstances where social distancing in the home is not possible, and therefore social distancing on a beach or at a grocery store is also not required of household units.
I could address your question. that's actually a great example of community coming together. I've heard that there are certain retail outlets that are opening early just to serve our seniors right now, and I think that's you're going to see more and more of that as our community comes together to address this issue. We are in contact with the grocers. We are working through some issues with them with their supply chains, and it varies. We're hearing that some outlets aren't having any problems with their supply chain, and when there are other outlets that are having difficult distribution issues. But we're committed to working with them to see what we can do as county government to help them make sure we're able to provide the necessities for our community.
As far as Cal Poly students go, some haven't left for their hometowns yet. What do you recommend on them?
I understand that President Armstrong is going to be addressing that situation later this afternoon.
And one other thing, is there a plan for eviction bans at the county level?
Yes, there is. My intent was to get that out yesterday. We were not able to get that out yesterday, but that will be out by the end of the day today.
And any kind of extension on property tax deadlines or anything like that?
I'm talking to our auditor, controller, treasurer, tax collector about options and how we can provide some relief to our constituents right now. I would, in closing, again, I would like to thank the 7 city managers that are standing behind me. This has been difficult for the county. It's also been difficult for the city, and we have a very strong partnership with the county, working with the 7 cities, and communication and collaboration is excellent, and we will get through this together, working as a community, working as the 7 cities, as the county together, moving our constituents forward. So thank you.
Thank you all for being here today, and we've brought up something that I neglected to recognize, the city and county leaders that are here and that have been working with us throughout this incident and will continue to work with us. And some, but of course not all of them, are represented here today behind us. We have Scott Collins from Morro Bay, Jim Lewis from Pismo Beach, Rochelle Ricard from Atascadero, Scotty Jalbert from County Fire, Jim Bergman from Arroyo Grande, Matt Benson, slaughter his name here, from Grover Beach, Derek Johnson from the City of San Luis Obispo, and Lynn Compton from District 4 of the County Board of Supervisors. So we appreciate all of their partnership. And again, before I close, I just want to call attention. I'm going to read the numbers out that are on the board behind us, just in case people are unable to read them on their screens. We have the Phone Assistance Center that's open 8 to 5, 7 days a week currently, and that number is 805-543-2444. And the Public Health Recorded Information Line, that's 805-788-2903. And then, of course, readyslow.org, that's updated real time with all of our guidances and releases. Thank you again.
Okay, San Luis Obispo County Public Health wrapping up its press conference for today, and what we have learned: 7 confirmed cases, 1 additional case of COVID-19 since yesterday. We know there are 3 people in the North County, 3 people in the South County, 1 person on the coast, and we have learned that this latest person who did test positive is a person in their 40s. That person does have underlying medical conditions. The other big takeaway today from this public health conference is that there is a mandatory shelter in home that is starting tomorrow evening at 5 o'clock. Now, this is being encouraging people to police themselves, and a host of activities will still be allowed: walks, hikes, bike rides, taking your pets out. A number of businesses will be able to continue as well, dozens and dozens, in fact. Essential travel is still allowed. Essential businesses will still be allowed to operate. That includes restaurants that are doing delivery or to-go only, grocery stores, stores that provide essential basic things that people need at home. Also, first responders, people who work in the media, people working on infrastructure. We'll have that whole list for you on our website. But again, this is basically encouraging people who don't need to be out and about to stay home, again, to police themselves. However, it will be a misdemeanor. If you're not allowed to be out and you are, there is a chance that you will be ticketed for this. Outdoor activities, again, are okay, but to remember that key phrase of social distancing, make sure you keep 6 feet between you and anybody that you are with, whether it's a friend or, of course, somebody that's just nearby. Household, though, is exempt, so parents are allowed to hold hands with spouses, with children, that sort of thing. They anticipate this order to remain in effect for 30 days. However, they will reevaluate coming up in 2 weeks. Labs, talked about that, the lab work being done for testing. They actually said the limitations really have to do with staff and with the machines, the numbers that they have. However, they're also bringing retirees back out on the front lines to help with this coronavirus pandemic. Anticipating they won't reach some of the model numbers that people are seeing out there right now, but given the fact that there are 7 confirmed cases right now of COVID-19 in San Luis Obispo County, they do anticipate that number could double in the next week or two, so just something to prepare people for that. They are preparing for the worst, hoping for the best, is what Penny Borenstein said. They just put on order 100 additional ventilators at a cost of $100 million. Just kind of updating the public on what is in place right now. 60 ICU beds, 450 medical surge beds, also alternate sites for hospital services. They're trying to maximize all the equipment as they have, as you can imagine. And again, also giving kudos to many of the retailers, the grocery stores that are opening up extra early to help people who are older, people who may be most vulnerable, so they're able to get out and get the basics that they need without being in the mass crowds. 2 takeaways, we just kind of touched on them, but social distancing, keeping that 6 feet is huge in flattening the curve, keeping that number of cases, positive cases down. Also, those are just the 2 keys to really remember, the 2 takeaways. Also want to share with you a couple of phone numbers. So if you don't have a pen and paper, grab something real quickly. These are important numbers to have in your home. 805 let me give you this one that's up now. Okay, we'll go back and forth. 805-453-2444. And this is specifically for folks who are seeing any price gouging. Let me repeat that. 805-543-2444. And readyslow.org. For more information. That's a great site to log into and to try to find some more information. That other number to give you, this is right here on our screen too, 805-788-2903, and that is recorded information coming from the county that they update throughout the day. So we will have full team coverage of the impact of the coronavirus, what it's having on the Central Coast. That's coming up tonight on News Channel 12 at 5 and 6 o'clock. We will also continue to carry these news conferences every day live and in their entirety. You can watch on air and online. And we have a special section on our website solely dedicated to the coronavirus, where you can read the very latest updates and you can find local resources. Just head to our mobile app or kcoy.com/coronavirus. We'll see you this evening at 5.